anybody tell me what the major influence in your life is that affects your health and your ability to thrive and not just survive? Anybody know? I'm going to give you a hint. Stress. Stress, right? So let me ask you guys one other question. Can you guys see me still on the screen or no? You can see me?
Yes.
Oh, I heard you there. All right. Okay, cool. All right, so in any case, anybody know what stress is? Any idea what stress is? You want to tell me what your thought is? No? All right, well, I'll tell you what. I'll give you the definition. The definition is stress is a heightened response to routine and out of the ordinary conditions and events. Okay, so that's stress. Stress is, you freak out about something, whether it's routine or whether it's something that's not routine, something out of the ordinary. So here's the thing. Stress affects a lot of things. It affects our attitude, our energy, our sugar levels, our hormone system, our immune system, our digestive system, our nervous system, our respiratory system, relationships, thought process, heart rhythm rate, and posture system. So stress affects life, okay? There's good stress and bad stress. And but the key here is to understand that, stress plays an effect on your life. And so I wanted to give you a few statistics. 70 to 90% of all visits to the doctor are for stress-related illnesses. 50% of all illnesses are caused by stress. And 70% of people surveyed said that they felt stressed at some point in time, just in a typical day. So that's kind of a lot going on there. There's a little bit more I had on here. Where's that? Oh yeah, 43% surveyed said they suffered noticeable physical symptoms of burnout. Stress is responsible for 19% of employee absenteeism, and stress increases the risk of back pain symptoms by 5 times and cancer by 3 times. So stress is a major player in your health, and it will affect how you can thrive. And so how do we combat this stress, and how can we thrive when all this stress makes it hard just to survive? Well, that's what we're going to talk about, because there's 6 major stressors in life. Anybody know what they are? I'll let you type them in the chat. Any thoughts? Well, I'll give them to you. Physical, chemical, nutritional, emotional, electromagnetic, and allergy. So here's what we're going to do. We're going to go through these. First thing we're going to do is we're going to talk about physical stress. Now, how do you get physical stress? Well, physical stress is one of those things that happens anytime you have injuries or poor posture or repetitive movements, like, working in the same job or bending over the whole time, running the vacuum, whatever it is. But the question is how does it affect your health? Well, if we understand that the spine is what is the housing of the nervous system, and when you put stress on the spine, it's going to make a change. And remember, it's all about the nerves. So if you change how the nervous system functions, you're going to change your stress. Okay, so let's look at a breakdown on how this functions. You guys have been with me, you've seen this before. It's the feeling versus function chart. And the thing I always like to remind people is, look, this is a depiction of a nerve coming out of the spine, okay? And every nerve that comes out of your spine is kind of like this, where 90%, I don't know if you can see me circle this or not, but 90% of this top part right here where it says motor nerves and autonomic nerves, 90% of every nerve is for how you function. 10% of it is for what you feel, okay? So 10% is what you feel, and only half of that is for pain. So research shows that you have to lose 60% of the function of the nerve. That's the 90%. You have to lose 60% of that function before you begin to transmit pain. And if you're already in pain, that means you're already functioning at less than 40% right now. So, and that doesn't mean your whole body. That just means whatever nerve is coming out of that area that's causing you a problem. So what controls your health? Well, remember, Your brain controls every cell, tissue, and organ of the body, and it does it by sending a signal down the spinal cord and out through the nerve roots. Now, this shows you what is controlled. What is controlled? Everything. Everything. Your heart, your lungs, your liver, your kidneys, your intestines, your reproductive organs, every single thing in your body is controlled through your nervous system. Okay? So, how do you thrive and not just survive? Well, you have to make sure that your nervous system is functioning properly. You have to make sure that those organ systems that are getting the information from your brain are getting it without interference and are getting it unimpeded. Okay? The deal is that the body has to be in balance. It has to be in balance to allow itself to heal. And so this is a really cool, this was one of the research papers that was out there. And they took 50 cadavers, so 50 people who had died, and they found that 49 out of those 50 people had some sort of a curvature in their spine. Then each time that cadaver had a sick organ, all you had to do was trace the nerve back to the spine, and you would see that there's a spine problem there. At the same token, if the more damage that they found in the spine, the worse the amount of sickness of the organ system. So when the nerve can't get information out there, then you're going to have a problem making sure that that part of the body is functioning properly. So you can't thrive if your nervous system doesn't function properly. So this is all part of the physical part of physical stress. Here's a research article. This is the chief of cancer prevention in New York's Preventative Medicine Institute. And what he did was he took a bunch of people who had cancer and a bunch of people who had chiropractic care. And what he wanted to do was he wanted to see what the difference was when the people who had chiropractic care compared to the regular population compared to cancer. And he wanted to see if there was a difference in how their immune system functioned. So this was a 3-year study. There was 107 patients, and the people who had been getting chiropractic care had been getting it for 5 years. What they found was that the chiropractic patients had a 200% greater immune system competence than the people who didn't get chiropractic, and a 400% better immune system competence than the people who had cancer or other serious diseases. So the thing that they found, and what this researcher said is, he said he'd never ever seen a group other than this chiropractic group who had a 200% higher immune system competence than normal population. So remember, when you get adjusted, when you keep your nervous system functioning properly, your body functions better. And when your body functions better, your immune system functions better, and you function better as a whole. So the question I usually like to ask people is, what is your health worth to you? Well, the average person, this is another study, the average person has 90 nanomoles of cysteine, okay? So what we know is that at 90 nanomoles, your risk of developing any of the 9 major disease categories like heart disease, kidney disease, liver disease, thyroid disease, your risk of developing any nine of those is 95%. So you have a 95% chance you're going to get one of those, okay, at 90 nanomoles. Now, this is where the research gets pretty cool. So you're pretty much guaranteed at this point in time that if the general population, you're pretty much guaranteed you're going to get something, okay? But here's the kicker. After 1 year of having regular nervous system adjustments or getting chiropractic adjustments, the average person's levels went to 124. After 3 years, their levels went up to 146. So here's the one, is that at 120 or more, the risk of developing those 9 different disease categories plummets to 5%. So you have a 90% less chance of getting one of those diseases when you get chiropractic adjustments regularly. This is one of the reasons why my entire family and myself, why we've always gotten adjusted. And, I get adjusted every week. My family does, my staff does. So I just feel that it's extremely important for your brain to be able to tell your body and your body to be able to tell your brain back what's happening. And so, it's really important. So step 1 to thriving and not just surviving is be sure to remove the interference from your nervous system. In other words, make sure you're getting adjusted. Make sure everything's working right, okay? All right, stress number 2 we're going to talk about is chemicals and toxic stress, okay? When we talk about chemical and toxic stress, there's a whole bunch of different things that are out there, okay? First of all, right now, we are exposed every day to 80,000 different toxins, okay? That's a lot. And there's, we're also, sorry, I have to put my glasses back on because some of this is kind of small for me. There's 800 million pounds of herbicides each year that we're exposed to, and there's 167 different industrial chemicals that are found in adults with no employment-related exposure. Let me tell you also, they have done tests on babies, and they checked the umbilical cord, okay? And what they found is that in that umbilical cord, there was already over 120 different chemical toxins in that umbilical cord that the mother passes on to the baby just by what she is eating, what she's breathing, what she's exposed to. So where do we get these toxins? Well, we get them from the air, we get them from the water, we get them from preservatives and additives, certain different household cleaning products. You know, you got to pay attention to what you're cleaning your house with, because the other thing too is, like, let's say you get brand new carpeting. That carpeting's outgassing, and you know, you're being exposed to these chemicals all the time. Cigarette smoke, of course, we know that that's horrible for us. Dyes and paints and certain personal hair care products, and not just hair. Think of this. Everything that you put on your body, your skin is the largest organ system in your entire body. So when you put deodorant on, make sure it doesn't have aluminum hydroxide in it. Make sure it doesn't have aluminum in it. When you are putting on creams, make sure they don't have all the different toxins that like PEG, propylene ethyl glycol, which is a horrible toxin. And yet it's put in your shampoos, it's put in your soaps. So look, and if you see PEG in there, it's bad. In fact, it's in most hair products and most creams. So it's something that they use to make things thicker. But if you're exposed to propylene ethyl glycol, they tell you, oh, you know, call the Poison Control Center. When we talk about preservatives and additives, you know, the reason I want to talk about preservatives and additives is because what you'll find there is you're getting all kinds of stuff that normally, you know, formaldehyde, all kinds of other different things that are in foods that should not be in there. What else did I want to talk about? So medications, a lot of medications are going to cause problems. Dental amalgams. Why would dental amalgams cause you a problem? Well, because if the dental amalgams have mercury in them, those silver fillings, they have mercury in them. So that's going to leach out into your body, and it's going to cause you all kinds of problems. Car exhaust. If you're in a car all the time and your window's constantly open and you're sitting at red lights and you're following a truck and you're sucking all those bad fumes in, you're getting all kinds of cadmium when we look at heavy metals. So, you know, this is just another form of toxin. We live in a toxic environment. In fact, between 2011 and 2015, they dumped 14 billion pounds that was permitted, over the permitted limits, okay? And these chemicals were either dumped into public sewers, or they're released in the ground or surface waters. You know, what do you think that number is today? It's a lot more, I can tell you that. A vast array of pharmaceuticals. So think about antibiotics, anticonvulsants, anti-inflammatories, mood stabilizers, sex hormones, whatever. A lot of these are found in the drinking water. Why are they found in the drinking water? Because people are flushing them down the toilet, okay? And when you flush this stuff down the toilet, it goes into a bad place, which is your drinking water, because the toilet water, I hate to tell you, but the toilet water, when you live in the city, goes through a plant, they clean it up, they chlorinate it, and they send it back out there for you to drink it. Now, I would highly recommend that you put some sort of a carbon filter on your, not just your drinking water, but also on your shower, because you see I put in here fluoride and chlorine. fluoride, not only in your toothpaste, which is horrible for you, but they put it in water supply. And it's really bad because it messes up your pineal gland, and your pineal gland has to do with your hormones. So people's hormones are getting screwed up because of this fluoride. Chlorine attacks two places. It attacks your thyroid and it attacks your pancreas. So we wonder why we have diabetes and so many people with thyroid problems. It's because we're sucking all this chlorine in. And even if you're not drinking it, that doesn't mean that you're not breathing it in when you're in the shower and all that hot water is on you and you're just sucking it right into your lungs. So these are things that people don't think about or don't know about that I'm trying to help people to understand it a little bit more. So we get these toxins, as I just said, through our lungs from things like exhaust, toxic fumes, secondhand smoke. It also, as I said before, it penetrates through your skin, whether it be perfumes, lotions, hairsprays, whatever. And the food additives and the soft drinks and things like that go through your digestive tract. So sometimes we poison ourselves. Now, how do these toxins, what kind of effect do they have on us? Well, it can make you tired, can have sleep problems, skin issues, like rashes or eczema. It can cause you low libido, indigestion, and other temporary gastrointestinal upsets, joint discomfort, so joint aches and pains, food cravings, which means you're going to gain weight, and reduced mental clarity, like I was just having a little bit ago when I was trying to remember something. So toxins definitely affect our health. So step 2 to thriving in this face of these toxins would be, number 1, consider doing a purification or detox balance. Now, I'm not going to talk about those today, but I will tell you that you can go on to sopcheckchiro.com and go into videos, and we have videos that explain the difference between the detox balance and the purification. Read what's on your products. Read what's on your hairspray. Read what's in your deodorant. Read what you're putting in your mouth, in your foods. Look to see what you're poisoning yourself with. Make changes at your home, okay? In other words, they have, I think it's called Norwax or something like that, where we have, it's got silver in it. So it's like, silver always used to be used as an antibiotic. So you can wipe things down with that, and it not only is it great for cleaning things, but it also helps to kill bacteria and toxins. And finally, as I just said before, consider getting some sort of a carbon filter, check your toothpaste, watch out for the fluoride and the chlorine, okay? This is what the 21-day purification looks like. If you're looking to lose weight, this is a great product to lose weight on. This is what most people lose, anywhere from 8 to 25 pounds over a period of 3 weeks. It's phenomenal for dropping sugar levels, cholesterol levels, and it's a really great product. Some people, on the other hand, can get headaches with it. Like my wife gets a headache when she tries to do that. We're able to do this one, which is a 28-day program, and this is called the SP Detox Balance. This is another great program. You're just not going to lose as much weight with this one. Now, when I say watch your exposure, there's 2 things. I told you that there are like going out golfing, people go out golfing and you got all these pesticides. Well, that's what's called xenohormones. And what they do is they get into your body and they actually, it's like putting a key into a lock. You put the key in the lock, but it's the wrong one. So it goes in, but it won't turn. So you get these xenohormones from the pesticides and herbicides that are sprayed on grasses in different places. And they get into your body and it changes how your hormones work, because your hormones can't get into the receptor sites because the receptor sites are full of keys that don't work. So there's 2 things that we have at our office. One's called the 12 Touch Me Nots, and the other one is called the Worst Foods. I have these. If you're interested, we can email them to you. The Touch Me Nots gives you information about like PEG and sodium lauryl sulfate and a bunch of the other things that are in different products. So I can get those to you if you're interested. And then Worst Foods, it just talks about which foods have the most toxins and pesticides and herbicides. Remember, it's always best to do organic. It's always, the research that was done through Rutgers found that there was 330 times the nutrients in organic foods compared to conventionally grown. Now, if you grow them out in your own yard, as long as you're not putting herbicides and pesticides on them, great place to do it. All right, number 3, nutritional stress. So since we're having problems with people being able to talk, which I was really hoping for, I guess I'm just going to give you some examples of nutritional stress. So the first would be food additives and artificial sweeteners. Artificial sweeteners, what are you talking about? Like sucralose. Sucralose is another term for, oh my gosh, I just lost it. Oh well, anyways, it'll come back. But sucralose and a bunch of these artificial sweeteners like acesulfame potassium and NutraSweet, some of these, they're horrible for you. And all you have to do is look them up and you'll see that there's all the different problems with them. GMOs, you know, the genetically modified foods, our bodies really aren't sure exactly what to do with these foods, okay? You get into sugars and processed foods. Sugar causes inflammation. If you listen to one of my talks before when we talked about heart health and the cholesterol myth, you'll see that sugar is a major inflammatory problem for your blood vessels. And if you want your cholesterol to go up, then eat sugar. If you want to have problems with your heart, eat sugar. Alcohol is like sugar, okay? It gets straight into your system, and so you have to be careful about that. Synthetic vitamins, if you go onto my website again and you go down and watch into the videos, one of the webinars I did was called Can Taking Vitamins Kill You? We talk about the difference between whole foods vitamins and synthetic vitamins. Hydrogenated fats. Hydrogenated fats is like trans fats, okay? So it's a trans fat. And the difference between a regular fat and a trans fat is that regular fats stay in your body, hydrogenated fats will stay in your body for about 51 days. That's the half-life. Whereas a regular fat's only 14 days. So those bad fats stay in your system and mess up your brain, which needs fat, messes up your nervous system for a long period of time, 7 weeks, okay? So you want to stay away from that. All you have to do is, when you look at a label and it says 0 trans fats, by the way, it doesn't mean that there's 0 trans fats. You actually have to read the label and see, does it have hydrogenated soybean oil or any of the different oils? Because according to the FDA, if you have less than 1%, then you can say that it's 0 trans fats. So you have to pay attention to that, because you can have 3 or 4 different oils in there that all have like 0.99%. And now they're saying, oh, there's 0 trans fats, where there's not. There's plenty of trans fats in there. Now, what do ingested toxins look like? Well, you have MSG, you have high fructose corn syrup, you have trans fats, and you have sugars. And I'm giving you some pictures because people don't realize that when you eat a bunch of spaghetti, that's like eating a 1/4 cup of sugar. When you eat have a glass of Coke, that's a 1/4 cup of sugar. When you're eating a bagel, that's a 1/4 cup of sugar. There's so much that you have to be careful of with all the sugar that's out there. And remember, we just talked about the inflammatory problems. If you're one of the people that likes to eat at McDonald's, let me just show you that this was one of them out there. I have a friend actually in Iowa that did the same thing, and we are at 13 years now that he has not just McDonald's. He has McDonald's, Burger King. There's 2 Hardee's and somebody else, and none of them are bad. Okay, so this right here is 4 years and 9 months and 27 days difference. If you look at the very first one on day 1, April 10th of 2010, and this next one here was 1,761 days later in February. So that's a long time to have a burger that still looks like a burger, a fry that still looks like a fry. Where's all the mold on these things? Okay, there's so many preservatives in it that they don't even go bad. Okay, and when we talk about these preservatives, over 14,000 additives to our food supply. Right now, we're eating 150 pounds of food additives every year, and the average per person is 180 pounds of sugar per person per year. Now, at the beginning of 1900, it was 10 pounds. We are now at 180 pounds. That's a lot of sugar. And we wonder why, again, we have problems with obesity, why we have problems with diabetes. It's because we pound the sugar. No pun intended, well, actually. Anyways, so step 3 to thriving with nutritional challenges is change the way you eat and change the way you feel. It's that simple, but it's hard to do, right? Because you have to pay attention. You aren't what you eat, you actually are what you digest and what you absorb. And that's important. So your gut has to be in good shape. The problem is that our foods are nutrient deficient, and that's due to poor farming methods and due to all the herbicides and pesticides and stuff that they put on there. Remember, I told you guys before, well, actually I didn't tell you. If you were to take one head of cabbage from 1900, it would take a pickup truck full of cabbage to equal the same number of nutrients. That's how depleted our foods are now. Here at our office, we use whole food supplements. Why? Because you can't get enough nutrients in the food anymore. You just can't unless you're eating all organic and you've grown it and you've picked it right where it's in your own yard. I do something called nutrition response testing, where we find out what organ systems are weak, and then we find out exactly, specifically for you, what nutrients are needed to upregulate those systems. So we've been doing this since 2003, which is a long time, and we've had great results with it. So again, how can we thrive with poor nutrition? Well, since our food is low quality, supplement with organic food, supplement with whole foods. If we look at food different, that's the key. When you change the way you look at things, the things you look at change. And that was from Wayne Dyer. And so maybe it's time to detoxify. When you go grocery shopping, make sure you shop on the outside of the grocery store, because that's where all the good stuff's at. All the perishable stuff, all the stuff that's got all the stuff that keeps it in there. You know, let me explain something. When you get a box of, let's call it Fruity Pebbles or whatever it is, and you buy food like that that's sitting on the shelf, they take out all of the good nutrients out of it. You'll see fortified with, okay, fortified with, why do we have to fortify it? We fortify it because if you don't fortify it, there's no nutritional value. They take out all the good vitamins and nutrients because they spoil. So the easier, you know, the better the more you take out of the nutrients that spoil, the longer it can sit on a shelf. So you just spray on and say, oh, well, we fortified it with, you know, vitamin D or whatever. Well, that means they sprayed a bunch of fake synthetic stuff on it to make you look and think that you're getting nutrition when really they've stolen all the nutrition from it. So also look for hormone-free meats. Grass-fed meat is the best, okay? All right, number 4, emotional stress. This is what we call issues in the tissues. Well, how does emotional stress cause us problems? Well, it can cause pain because, remember, I said issues in the tissues. I've had a lot of patients who have had pain issues that don't go away because they've buried some sort of an emotion in their tissues that, you know, you do the hard work, but if you don't clear up the emotional, a lot of times things won't always go away. Failed goals, you know, it's how you feel about yourself. Illnesses, fatigue, depression, anxiety, panics. There's so many different stressors that that we place on ourselves. Death, abuse, job stress, bad relationships. All these place emotional stress on us. Okay. Now, words have power. What do I mean with words have power? I all the time I hear people say, well, you know, this is my bad knee. It's not your bad knee. It's a good knee. It's just not functioning properly. When you call it a bad knee, now your body says, oh, this is a bad knee, and you start having more problems with it. You say, I've heard people say, oh, I'm such a loser. No wonder I can't get this right. I can never do this. I can't do this. I can't do this. And when you continually speak to your body that way, your brain hears, I can't do this. I can't do this. I'm a loser, whatever it is. And your body starts to adapt that personality. So you have to be patient and you have to pay attention to the words you use. You know, in the Bible, it tells us that the tongue is the rudder that guides the boat or guides the ship. And so, you know, make sure you pay attention to what you say, emotional stress, as I said, causes physical problems. I had actually, I'll tell you about, I could tell you bunches of stories, but I'm just going to make one real quick because I don't want to keep you on here all night. I had a guy with a herniated disc and I started treating him. And after 2 weeks, after a week and a half, I wasn't getting anywhere with him. I'm like, look, there's an emotion tied to this. You need to go do some emotional work on this. And he put me off for 2 or 3 visits. And this is when Lindsay, who does the neuroemotional work that I send people to, it's called Total Positivity, TOADAL Positivity. She's in Willoughby. If you want to get in touch with Lindsay, contact me and I'll tell you how to get to her. But she's wonderful. And she was working with us at the time. And I said, go see Lindsay. And he came out and he's like, wow, that was different. I feel better already. And I had been working on him for 2 weeks at the time, and we were having, because he had just herniated disc, we were having such a hard time getting it to work right. And by changing some emotional baggage that he had from who knows when, he was able to actually make a change. So step 4 to thriving: emotional stress relief techniques, such as the neuroemotional technique that I was just telling you about. Tapping solution. You can go on to Mercola EFT and see emotional freedom technique, which is an amazing technique, which is the same as the tapping solution technique. It's actually, I have videos of those on sopcheckchiro.com as well. It's just a really great way to change how your body adapts or responds to stress. Perfect example. When I used to testify in court for patients who were in car accidents, when I used to do a lot of that type of work, I would get nervous going in there. My hands would shake. Well, you can't shake in front of a jury. So if I did my tapping, my hands wouldn't shake. And I used it for getting stressed out on the golf course. You can use it all kinds of different places. So it's a great way to do things. So that's the tapping. HeartMath. If you go onto HeartMath, I think it's heartmath.com. It's another way to be able to change how you respond to stress. EMDR, which is eye movement. I can't think of what it is. It's an eye movement technique. And we have a patient who does that. Herbs, nutrition. A lot of times you just need something to help enhance your body. So people with a lot of anxiety and panic stuff going on, they might need kava, or they might need Nivatin Forte, which is a combination of St. John's wort and skullcap and several other things. Or if they're depressed, maybe they need St. John's wort. And it really makes a difference as to where you get your nutrition from. Okay, I mean, that makes a huge difference. So our herbs we get from Australia, and you know, they're high quality. One of my colleagues had a patient who was depressed, and he was talking to her, and she's like, well, I'm already taking St. John's wort. And he goes, well, let me see what you've got. So they took the St. John's wort that she had along with the MediHerb St. John's wort. They took it out, they got them evaluated, and wanted to see what the main ingredients was and everything in it. When you looked at the active ingredients and what she was taking compared to the active ingredients in the MediHerb, she would have to take 17 of the stuff she got in the grocery store to equal 1 of the MediHerbs from St. John wort MediHerb. So in order to get the same amount that he was recommending, which was he had recommended 3 of them a day with her, she would have had to take 51 pills to get the same amount. So just because it says St. John's wort, just because it says whatever herb it is, doesn't mean that it's good quality. Okay. Now, how does emotional stress affect my health? Well, here's a little bit of research for you. There were 394 healthy subjects, and they were given nasal drops with 5 different respiratory viruses. Okay, so what they did was they took viruses. 3 of them were rhinoviruses, 3 of them were, one of them was respiratory, and one of them was a coronavirus, not Corona 2, not the one, not COVID. And they squirted them up their nose, okay? So that what they did then was they had these people complete questionnaires to see how much stress do you actually have. And what they found is that the people who had more stress were the ones who got sick. So psychological stress is actually a predictor for what how you get sick. And they found that 25% of those people who had the viruses shoved up their nose still didn't get sick. So there's a lot of people out there who are running scared because of the virus that's out there right now. And they're running because they're like, oh, it's germs and you're going to pass this germs to me. Well, it doesn't work that way. You know, if your terrain in your body is weak, then some sort of a germ can cause you a problem. But if your terrain is strong, if you're taking, like 5,000 IUs of vitamin D3, if you're taking your zinc, if you're taking your Cataplex C, which is a whole complex vitamin C. What else are we taking? We're also taking Echinacea Premium. And the other thing that we're doing at our house is everybody's taking some sort of adrenal support. The reason we're taking adrenal support is because your adrenal glands are what handles all stress. If your adrenal glands are fatigued or beat up, you're going to have problems keeping healthy. That's one of the reasons we do that blood pressure test here, where we have you sitting and then we have you stand up to see if your blood pressure goes up or down. It should always go up. It shouldn't go down. If it goes down, that tells you you've got adrenal exhaustion. So anyways, let's move on. We have electromagnetic stress. This is the 5th of the 6 stresses. So we're almost done, guys. Where does electromagnetic stress come from? Look, we didn't have electromagnetic stress a couple hundred years ago. It comes from AC current. AC current's not been around a couple hundred years. X-rays, radio waves, microwaves, satellite waves. We didn't have any of this stuff. Wi-Fi, computers, iPhones, iPads, 5G. We didn't have any of this stuff before. But all this stuff affects our body because our body was never meant to be able to handle this stuff. There are things that you can do, however, to help protect you the best that you can. So when we talk about step 5 to thrive with electromagnetic stress, because we can't get rid of the stress, we have to be able to do something to be able to help us to deal with the stress. So this, if you look at here, this is a multipolar magnet, okay? I have this in my pocket every single day. Why? Because I'm constantly around electromagnetics. I'm around, I'm using the electromagnetic, I say electromagnetics, but the AC current. If you got your hands on a computer, you're doing work on a computer, you're exposed to all this computer radiation, you're exposed to the AC current, you're exposed to lights up above you. This multipolar magnet, they're 30 bucks, and it is something that anybody who's on a computer should have. And the reason you should have this is because what they find is that people who are sitting at a computer within an hour or two either get tired or cranky. When you're using this to help protect you, it helps your body to function at a better level. And it helps you to be able to deal with the AC current that's coming off of all this stuff around you. The R2L. The R2L is a product. This is what it looks like. And I have it on my phone. Everybody in our entire house has it on their phone. I'll see if I can turn my phone on for a second here and see if it lights up for you. I don't know if it will or not. But anyways, this lights up, and sometimes you can see it when you're streaming. You'll see it on the back of your phone. And what it does is it takes electromagnetic radiation from your phone, okay? And we're getting radiated by this stuff all the time. And people have always got this up against their head. And we wonder why brain cancer is so predominant now. This is, again, 30 bucks. It reduces the amount of radiation to your head by 72%. Why? Because it takes the electromagnetic radiation, it turns it into light energy. And so it essentially pulls it away from attacking you. So this is the R2L. You can go on to earthing. There's earthing products that you can plug into your sockets, but it's not the electrical part of it, it's the ground. You plug it into the ground, which goes to the earth, and you can lay these sheets on your bed and you can sleep on them. That's what we sleep on at our house. There's a product called a Total Shield, which I don't have here. I thought I had it here, but I unfortunately don't. What it does is it protects from all kinds of satellite waves and things like that. It's a 20,000 square foot area. So the one I had here at the office broke a little bit ago. So I have to get a new one here. Harmony pendant is something that you can also get. A harmony pendant is something that looks like this. And what it does is it helps to protect you against 5G. So it's something that I use and my family is using in order to help us protect against 5G, because 5G is really bad for a lot of different reasons. I'm not going to get into those today because I know I'm running short on time here. But then the last stress is called allergy stress. Okay, why do we have allergy stress? Well, because there is so many people that have allergies out there, and they cause, whether it's stuff outside, whether it's the grasses or molds or the trees or pollen or flowers or whatever, whether it's car exhaust, cigarettes, whether it's foods, whether it's perfumes or gold or silver or any, different heavy metals, formaldehyde, chemicals, you know, there's so many different things that people have developed sensitivities to. And the problem is that when people have these allergies, you know, it can cause a change in how you breathe. And when you change how you breathe, it's going to decrease the oxygenation to your tissues. You know, oxygen is really important. And so this is another problem that we have when we do this and we're not sucking in enough oxygen. That doesn't affect allergies, it affects your brain. Decreased performance on the job. Why would you have? Because if you're constantly blowing your nose, your eyes are running, how are you focused on what you're doing? Has a decrease in your immune system. Why? Because it's a stress. And anytime we have stress on our system, it reduces our immune system function. Remember, I told you before, when you have stress, it attacks your adrenal glands. And when your adrenal glands get tired and fatigued and overrun, your body is opened up for having to get sick, okay? And just to back up just a hair, because I was talking about it before, was that study that I had given you about the coronavirus and the other viruses being shoved up their nose. A buddy of mine and his mom, his father and his mother, they were on a cruise ship. And this was when everything first hit. And the mom got the virus and dad didn't. And they were in the same exact room. So, you know, just because you're exposed to something doesn't mean you have to get it. All right. Decreased socializing. Who wants to go out when they feel lousy and their face is all puffed up? What kind of allergens are there? As I told you, there's animal danders, hair, pollens, trees, grasses, heavy metals, foods, synthetics, medications, clothes, perfumes, all kinds of different things that people are synthetic to. What causes allergies? Well, there's a lot of things that cause allergies. The biggest is a gut problem. When you have a problem with your gut and you have leaky gut, the body starts to attack anything that goes through and says, oh, this is something that we shouldn't have here. And so it attacks the allergy and it causes an allergy. So gut is the main issue. Okay. You have to have a healthy gut if you want to have, to be able to fight allergies. Unfortunately, childhood shots cause problems with the gut. And so we see a lot of kids who have allergy problems that didn't happen before, because when I was a kid, there was only 3 of them and now there's 72 of them. All right. Oh, and GMOs are the other thing too. So how can we reduce the allergy stress? Whew. Well, we do something called reharmonizing. So what we do is we use something called allergy sensitization, elimination, and reprogramming technique. Okay, so it's ACERT. And what we do is we actually take whatever the allergy is, we put it in a plastic bag or something like that, and we put it up against your body. And so the energy of that up against your body, and then we laser a bunch of different points on your arms, your legs, your chest, your back, and it upregulates, it kind of reintroduces whatever the allergen is to your body so that your body can say, oh, okay, I know this guy, and not fight it. It works amazingly. We've had so many people, I've done this on thousands of patients over the years, and it just works great. So step 6 to thriving and dealing with allergies is number 1, avoid foods or other things that cause you to react to them. So, you know, avoid things that you know you have allergies to. If you have an allergy to milk, then don't drink milk, because it's going to cause you typically skin issues and gut issues. Do a gut repair. So there's a protocol that we use with different herbs and different products that helps to repair the gut. You can try Antranex or Allerplex. If you're having stuff going on from outside, Antranex and Allerplex are 2 great products that really help the body to be able to deal with allergies a lot better. And lastly, consider doing the allergy sensitivity elimination reprogramming technique in order to help you to move through things. All right, so summing all this up, in light of all these stresses, how do I thrive and not just survive? Well, physically, get adjusted, remove that nerve stress. Nutritionally, eat well, do whole food supplements, avoid the bad stuff. We talked about all that. Toxins and chemicals, avoid skin contact, avoid eating them, consider doing a detox. Emotional, you can do tapping, EMT, NET, EMDR, EFT, heart math. Any of these things are a great way to help you with emotional stress. Electromagnetic stress, use a multipolar magnet or an R2L or an earthing or any of those things that we talked about before. That's going to help to neutralize a lot of these stresses that are coming at us electromagnetically. And finally, allergies. We talked about repairing the gut and considering to reharmonize your body. So I'd like to close with just a little bit more research. And this one is immune boosting through chiropractic. This was Dr. Kevin Tracy, and he was talking about how the brain speaks directly to the nervous system. And he said that, you know, it sends commands. We already talked about how the brain controls everything. He's talking about inflammation and infection and autoimmune diseases, okay? And he found that stimulating the vagus nerve, that's the brain, the nerve that goes from the brain directly to the gut, by stimulating that, you could cause, or you could block inflammatory responses, and you could treat a number of diseases. In fact, we use a laser, the purple laser, to stimulate that nerve so that we can block such things. We've had some patients who have had the prolonged issues from the coronavirus, who have had continued irritation. We use that purple laser on them a few times, and it's really helped them out a lot. Inflammation is a major player with autoimmune conditions, Crohn's disease, rheumatoid arthritis, Alzheimer's, and things like that. So here's another one. Dr. Felton and his team of researchers, found that the sympathetic nerve fibers that innervate lymphoid organs act on the spleen. So in other words, parts of the nerves that go to the lymphatics in your body will act on how the spleen works. And the spleen plays a major role in immune system function. And so they found that stressful conditions lead to altered measures of immunity. We just talked about how stress causes your immune system to be reduced, and increases your susceptibility to a variety of diseases. So the immune system can be affected through the nervous system, through this autonomic nervous system. And then I think this is the last one. They took a bunch of HIV positive patients, so that's AIDS, and they adjusted them. They used chiropractic adjustments over a period of 6 months. I believe this was done at a chiropractic college. What they found was that there was an increase, a 48% increase in the CD4 cells, okay? And these are huge cells for immune system functioning in the body. But the people who didn't get adjusted, not only did they not have an increase in these CD4 cells, they had a continued decrease by 7.96%. So what this is telling you is that the adjustment helped these people to have a better nervous system function, which enhanced their immune system. So I hope that gives you some good things that you can do to thrive and not just survive. I want to thank you for coming. You know, our goal here is always to help you to thrive and not just survive. And it's reflected, I believe, in what we have in our purpose, our mission, and our vision statements, which is our purpose for being here is to serve God and our community by saving lives, by illuminating the path to wellness, to thrive, and not just survive. Our mission is to enlighten, guide, motivate, love, and restore our patients to optimal physical and biochemical and emotional wellness. And the families that continue to partner with our wellness care all move, live, and perform better than those that don't. So we bring this up simply because this is how we try to work with our patients. And my wish for you is always to prosper and be in good health, just as 3 John 2 says. So if anybody has any questions, feel free to pop something in the chat box or the question air box.